I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. Today we're going to go through some exercises that you can do if you're experiencing pain in the back of your knee. One of the best exercises you can do is foam rolling, and we have various videos on our YouTube channel that reference that. That will help break up some of the tissue that is causing that pain in the back and the knee. You want to make sure that you target not only the back, but the sides and the front also. Some stretches that specifically can be done for the back and the knee is starting with a calf stretch. So simply you're going to bend the front knee, keep the back knee straight, foot and heel flat on the floor. You only take a step as far forward as you can to maintain that heel and foot on the floor. You're going to feel a stretch back in through here, maybe even up into the glutes, and probably down into the Achilles. You want to make sure your toe is pointing straight ahead. You're going to hold that 30 seconds, and you're going to do 6 of those. You're going to adjust this 2 more times. So you're going to turn your ankle in a little bit, so you're going to target a different part of the calf. You should feel this not necessarily in the center anymore, but on the sides. Again, you're going to hold that 30 seconds, and you want to do 6 of those, still wanting your heel flat on the floor. Then you're going to bring your heel out to this other side. Good. And you're going to hold that 30 seconds, 6 times. So you're going to have the center, you're going to have the side, and then you're going to have the other side. You're not going to be able to turn it very much. It's only going to be a subtle turn based on how much hip rotation you have. That's okay. Still do the subtle turn. You will feel it and target different parts of the calf. The next exercise is the hamstring exercise. I'm going to show you how to do this traditionally without a strap, so you can do this at any time. One of the biggest mistakes people make with a hamstring stretch is they bend forward, and they bend forward from the back. You're not at that point stretching your hamstrings. You're stretching more of your low back. So when you do this stretch, you're going to sit on the floor. You're going to bring one knee in, and you're going to sit up nice and straight, and then you're going to lean forward. The back is going to stay completely flat. She's not going to try and touch her chest to her knee. That's when you start to get into, notice how her back is curved. You don't want to do that. You want your back nice and straight and lean forward. You're going to get a stretch that is much more effective for the hamstrings as opposed to the low back. And the final stretch that we're going to do is another variation of the calf stretch. You're going to just, this time instead of keeping the knee straight in the back, you're going to bend the knee. You still want to make sure that this heel stays flat on the floor and that you are pointing your toe forward. This one is not effective to do in all 3 directions. You just want to make sure that your toe is pointing forward and your heel stays flat on the floor. You want to hold those 30 seconds 6 times. This is something you can do throughout the day, standing in the shower, brushing your teeth. You don't have to do these all necessarily in a row. The more you're able to incorporate these in everyday activities, the more likely you are to continue them, and the more likely you are to be able to do them more than once a day. If you're experiencing any pain, any numbness or tingling, you want to stop and contact your healthcare provider. If you have any questions, please call us at 215-997-9898 or visit our website at www.totalperformancept.com.